In addition to the organizations mentioned in the matrix, we hope to partner with community members through community engagement efforts, school districts such as LAUSD, Compton Unified, and Paramount Unified, as we believe that education plays a big influence on children's choices. And by partnering with schools, we will also have access to children for our research project. We also want to include the Department of Public Health in our coalition for additional support and funding, and also the California Family Health Council, who currently has programs in partnership with Planned Parenthood, such as the Street Team, that promotes STD prevention and control among teens. In addition, we want to provide a list of referrals to local community resources such as Martin Luther King Jr. Center for Public Health, the Children's Hospital of Los Angeles, and Planned Parenthood, who provides free and low-cost family planning services and sexually transmitted infection screenings, which we will provide to our participants. Our program will take about 18 months with the pre-planning and dissemination sections included. Our pre-planning will be about 3 months. We want to establish funding sources, create ties within the community through community engagement, and also conduct a needs and assets assessment among the community. Our second section is for planning, which will be 3 months, and we want to establish our goals and our objectives and also find out who our target community will be. Implementation will be about 9 months, and we want to do this, want to implement the intervention at the beginning of the school year through the end. This way we can reduce loss of follow-up and also for the ease of access to children who will be in school during these 9 months. Evaluation will be about 3 months, and we are planning to do a participatory evaluation method. As far as funding, we hope to get funding from state-funded grants, so we want to link up with the Department of Education, the Department of Public Health, and have alliances with high schools, universities, hospitals, and other current programs that are working in the community, such as Planned Parenthood. Our location for the peer counseling, we will have that take place within the schools at LAUSD, Compton Unified, Linwood, and Paramount Unified school districts, community centers, including the Girls Club of Los Angeles, and community health centers such as the Martin Luther King Jr. for Public Health Center, and Planned Parenthood will be used to provide sex health counseling and for focus groups for our parents and teens. Capacity building, social capital, and empowerment will be used throughout our program as we involve, educate, and train community members to be active participants in their health and in the health of their community. So our plan here is to actually target educational, attitudinal skills and behaviors, behavioral changes. So by having peer counseling, individual counseling, and focus groups for our parents, they'll focus on education, which we will teach them the basic knowledge of STIs and contraceptives. We want to target their attitude through empowerment, empowering individuals and families to take control and protect themselves and their children. And at the end of our program, we hope that parents and children will have the skills to discuss difficult topics such as sex, abuse, and and STIs and how to use contraceptives. We also hope that they will develop the ability to contact resources and locate local health clinics within their community to access health care services for family planning. Lastly, we want to target their behavior by increasing the use of contraceptives and by increasing their visits to clinics or health centers. Now we will discuss sustainability, our evaluation method, and how we will disseminate our findings. Sustainability, we plan to do this by involving members of the community. They will be empowered and will develop leadership traits and characteristics to identify, mobilize, and address disparities and problems among their community. I'm trying to do this by having meaningful educational sessions and partnerships with community members, including parents, teens, local health clinics, and schools. And also, community members will be trained to have the knowledge, skills, and tools to sustain the program by using resources available within their community. We also feel like a big, a big, a big pushing factor in sustainability is that in our program we want to include the children and teens, and by doing this, our hope is that the skills and knowledge that the teens gained in our program will be passed down onto their children and future generations, which will further decrease the number of unintended teen pregnancies and will also decrease the spread of STIs. For our evaluation method, we will use the participatory evaluation method, where we will involve local and external evaluators, such as interested organizations, stakeholders, and community members, to decide the purpose of evaluation, implement the surveys, and also interpret their findings. The evaluation team will include members of the community, local health clinics, organizations such as Children's Hospital Los Angeles, local universities, possibly USC, the Department of Education, and the Department of Public Health. Community members, part of our evaluation will also teach community members how to evaluate and conduct evaluations through surveys and key interview questions and through the focus groups that we will be having in our program. Our surveys will be distributed during intake, during the first peer counseling session, and this is of course with parental consent for minors, and during the first session of the focus groups for parents. Survey questions will test their knowledge base on sexual health, including contraceptive use and the effects of sexually transmitted infections. And it would also ask about their social environment and socioeconomic status by asking questions about their access to basic needs, trauma they have experienced, and their ability to access family planning services. The follow-up survey will be completed during the last session of the peer counseling session and also the last session of the focus groups. If for some reason participants do not attend the last session and aren't able to fill out the hard copies of the surveys, then we will conduct the surveys over the phone and we will try to contact them that way, that we don't lose too much of our participants. We want to disseminate our findings by partnering with various organizations and universities mentioned earlier, such as CHLA, Planned Parenthood, maybe the Kaiser Foundation, and the University of Southern California, and other universities who might be interested in publishing our findings. We want to create tables and charts at a readability level describing the findings and also indicating ways to protect themselves and things that were brought up during the peer counseling sessions and also the focus groups among the parents. And from that, we want to create a pamphlet and also a brochure specifically for Service Planning Area 6 with a list of referrals and community resources that they can contact. This wraps up our presentation. We hope that our project can be used in the future to help reduce the number of unintended teen pregnancies and also to reduce the spread of STIs in Service Planning Area 6 of Los Angeles. Thank you for your time, and thank you for taking the time to watch our presentation.